In this video, we will be reviewing how to change a patient's treating institute in Renal Insight. This information can be found on page 34 of the Renal Insight Nursing Manual, which is located on the Renal Intranet site. To begin, you want to open up the patient's personal information summary. To do this, you can either click on the patient card icon here, or click on Demographics and select Personal from the drop-down menu. At the bottom of the page here, you can see the different institutes that the patient has been treated in the past. If our patient is transferring to a different institute, we can add that here by clicking New, and then selecting the site that they're transferring to from this list here. For today's example, we're going to transfer them to the Z-Test Institute and pretend like that's a different institute than the one they're currently at. So we'll hit select, and then you're prompted to provide a reason for the transfer. Oftentimes for our patients, the reason could be geographical. Maybe this institute is closer to home for them. Or if they have to transfer to an acute or regional center because of an infection like peritonitis, we could select that. But for today, our patient is simply moving to a unit that is closer to home. And then once you've added that new institute, you can hit save. For a real patient, you would be able to find the date of their first clinic visit here in this column, and the date of their first hemo treatment here, as well as their first PD treatment. This information is important to providers and patients, and it's a lot easier to be able to find the dates here than to have to sort through weeks or possibly even years of progress notes to get them. So please make sure to input these dates for your patients. This brings us to the end of this video. So now you know how to change a patient's treating institute on Renal Insight.